And then you apply clean gloves. And so I'm going to apply clean gloves and show you how this neat little draping, it gives them a little more privacy, but still allows you to do what you have to do. Well, it's a simple drape. It's not required when you do SPD to do this type of draping, but it's a nice practice pearl to do, again, to give them a little more privacy. So you take corner of the drape, the sheet, and then you end up having the opposite, the diagonal corner of the sheet over here. So then I've got all this excess sheet up in here to kind of wrap around, and then I end up putting the corners down here on their heels. So then I keep him covered until the last possible minute, because I'm going to set up, and that's what I'm going to demo in a minute, set everything up, and then you're going to be sterile. So if you've got someone to help you, what would be ideal in the perfect world, then that person, before you move the kit here, can open up the drape and expose the patient. If you're the only one, which chances are you'll be the only one, then this works well until then you remove the drape and have him exposed and then start your kit. So they are going to be exposed, but there's nothing you can do when it's only you. But if you had a patient care tech with you, you could give him or her a little more privacy. So I kind of set him up over here so you can see the, and we've already done the two-patient identifier, and after Mrs. Smith, this is going to be Mrs. Smith this time, I've performed my hand hygiene. Yes, I have. And I've performed my hand hygiene and introduced myself to Mrs. Smith. And then the very next thing you want to ask her is what? In regards to?
Allergies.
Yes, allergies. Very important. This is a latex kit. And we have, with the students, placed a non-latex Foley on patients. And so it can happen. It happens a lot, in fact. And so you ask the patient if she has any latex allergies or if she's allergic to betadine. I haven't had too many allergic to betadine, but if you do, you switch it out with probably a Hibiclens or whatever the hospital has that has no iodine in it. So you ask them those questions. And this Mrs. Smith says, no, I have no allergies to anything. Okay, Mrs. Smith, I'm going to place a Foley catheter. You may ask if she's had one before. Maybe she has or maybe she hasn't. And Mrs. Smith says, no, I've never had one before and I'm really nervous. And you say, well, it's okay, Mrs. Smith. I'm going to let you know everything that I'm doing. It's going to take me a few minutes to set up, and then I won't do anything without letting you know what I'm going to do. And she says, okay. And so I'm going to, because I'm the only one in the room, I'm going to give her as much privacy as I can, but yet still getting to the area, the vaginal area, so that when I'm ready to do anything, I don't have a whole lot of stuff in this area to get in my way. Can you all see this? Good, good, good. All right. Okay, so as I'm draping her and draping her that way, like I said, I'd have my gloves on. I'd switch out my gloves, do a little hand hygiene, and get ready to set my kit up, okay? So the kits are, all of them are different. As even in the video that we showed you, one of the kits had the underbutt drape right away as the first thing. Well, if it's the first thing in your kit, that's what you take your bare hands, only with the corners, and you put it under. Most of our kits will have the gloves on top, and you'll see that's the way I'll demonstrate. I'm not exactly sure if this one has that, but I'm pretty sure. So this one has an opening at the edge, like so. And I'm going to move my trash can over here and do a little more hand hygiene. Now, the way I do it and the way it's demoed here as well as there are similarities and there are also some differences. Today, I'm going to utilize this as a nice little trash can. There are drawbacks and advantages to using this as an area for a trash can. Can anybody think of an advantage would be what? Yeah, I've got it right there. What could a drawback be?
It could fall under your shirt.
Oh yeah, it could fall. I'm going to make sure it's far enough not to hit my sterile field, but it could fall. What else about contamination? Because in a minute I'm going to be sterile.
Touching it.
Yeah, I have seen students put their touch their inside of their bag, and it's like. So you have to make a choice whether you want to do it, and it's how you practice, and that's fine, but make darn sure that you're dropping it, and you're not even coming close to that bag if you're choosing to use the bag. Because I'll show you another thing when I get it set up, another thing you can do. So again, all of these are different, but you want to open it sterilely, as sterile-esque. And this one's got it going this way, so I'll go away from me. Because I can touch this, right? This isn't sterile, because this is the outside.
I always hate that.
Pardon?
I always hate that.
It always scares me. Okay, so in this particular kit, what I'm going to do, and you can do this because remember, underneath is not sterile. I can move my kit around a little bit. Or what I'm moving is my drape, because eventually I'm going to move the kit and situate it a little bit differently because I don't like the way it is. But what I'm going to do now is, let's go this way. Watch how I take my finger and I push down on it so that this lifts up. So I'm not touching anything in my sterile box in my Foley kit, but I've got my gloves, and that's what's important. Now, I don't necessarily want to turn my back to you, but this is the edge I would use when I'm in the room. You know, I would use this to put on my gloves. But for the time being, so that I'm not occluding your view, I'll place my gloves on this way. I'm right-handed, so I'm gonna start. And these are enormous gloves, and they're gonna be enormous on most of you. We just make do, because when we go to the facilities, they're gonna be the same way, okay? And then I'm gonna sterile to sterile. This one I have to play with a little because it's wrinkly. Okay. And I tend to try to keep my thumb out so that I'm not contaminating. There we go. Now, I'm sterile to sterile, so I can take that and bring that down a little bit, but it works. It's not perfect, but it works. So, again, the inside is sterile, so I can just do that business. Or I could have went like that with my elbow. That would have worked as well. The next thing appears to be, it's kind of like Christmas every time you go in these bags, or these boxes, because you might have the underbutt drape. The underbutt drape might be first. Well, for me it was the gloves. So now I'm sterile. Now I can rearrange things the way I want them to be, keeping in mind my 1-inch margin, and I move this on over here. So this is my underbutt drape, it appears. And you will see, remember you're sterile to sterile, so you can open this without being too particular, but you will see one side is shiny and one side isn't. The shiny side goes down, and that's what I have facing you all right now, okay?
Move the table up a little bit.
Okay, that table?
Yeah.
Well, she's sterile, she can't.
Right, but
Yeah.
Dr. Robinson, my
Yeah.
patient care technician, can. What would you like?
Bump it
Towards us.
towards us a little
This
bit.
one?
No.
No.
This one.
Yes.
Now this way.
No, yeah.
You can't
There
see
you
the
go.
stereo.
You can't see what's in it.
Perfect, awesome, thank you
Thank
for
you.
speaking up. Now, the underbutt drape is necessary to give yourself a field underneath the patient, but as you're placing it, you want to protect your sterile gloves as well. Students sometimes get hung up with this because you want to make sure you're not contaminating yourself as well as when you're asking Miss Smith to lift up her bottom. So you're wrapping the underbutt drape like that. You're saying, Mrs. Smith, can you lift up for me? And you're doing it very like that. Is it perfect? No. I could turn around and go sterile to sterile and rearrange it, but she's a bumpy bed and she normally has legs, and so I'll go with the way it goes. The next piece is your fenestrated drape with a female. You guys have choices. You can choose to use it or not. And if you do choose to use it, I just have the students go, oh, no, that's bad. So then I kind of, and have it right here. Gives you a little extra layer of protection when you touch with your left hand. Personally, I don't use them, but I am today for you. All right, so now I am inspecting my kit. This particular kit, instead of the iodine and the cotton balls that you saw in the demo, they're swab sticks. Okay. So, swab sticks, and I'm gonna use my bag. And then you kind of lift them up to make sure that they're easier to get at for you. And then I stick them up in my box. And then I've got another one. I generally only use the 3, but I have them ready. I want to be a prepared nurse, so I'm going to have them ready. The lubricant, this lubricant you guys will not utilize. We'll just put it there, that's great. But we want to see that you're going to open it like you would in the clinical setting. So I'm going to find my hip, thank you. I'm going to find my area, I'm going to open it, and I'm going to squirt the lubricant. And then get rid of it. This is the syringe that, again, a difference from the video was they had a syringe of lube. Okay, fine. You figure out your kits. Again, they're all different. So this is my syringe that, for a minute there, let me pause. And bags are on these. I just kind of squirt out the bag. I'm sterile, so I can do these things. And I don't really care where this one falls. I'll pick it up if it doesn't hit the trash can. And then in the clinical setting, this is where you'll lube with the lube that's in the kit. For us and for SPD, this is where your instructor will be ready with the lube like Dr. Robinson just had, or we'll put it here on the kit. Either way, it's going to end up working out fine. So you give a generous amount of lube, because that's what we do with the mannequins. And then I put it back in my kit. Now this syringe, I'm going to put on it. The one I did the other day, it didn't stay on. And this one looks like it might not be either, but we're gonna just adapt. We'll adapt and overcome. So normally, the syringe would stay right on. And in the facilities, that syringe will stay on, I promise. There's no pre-inflation. Some of you that have been around a while know we used to pre-inflate the balloon. We don't do that anymore. We just kind of get ready with the syringe and no pre-inflation for those of you. So mine isn't sticking, so I'm just gonna go with it. Okay, so now I believe I'm ready. And this is where you can kind of take your breath and be ready to move the kit on over to in between Mrs. Smith. I've got everything I need. Let's do it this way. Okay, now is the step where you've got to be committed to lose a hand. This is the hand that once you touch her labia, once you touch the penis or the penile area, you can't move that hand. That hand is no longer useful as a sterile hand, okay? So I'm getting ready, and again, in the mannequins a little bit differently than in a real person, but you will take your hand and you will spread the labia minora to expose the area that you're going to clean. You're going to take one of the Q-tips if you've got the saturated Q-tips, or the betadine swabs if you've got those, and we're going to do outer first. And this is where you can and then you go outer first, then inner, coming to me, meaning the inner edge towards me. And sometimes I do that. When I don't use that, I just put it right there because it's not going anywhere. And then one more right down the middle. Now let's say I got dropsies and went, oh, well look, I still have my emergency pack. So I'm like, okay, well good. I made a little mess there, but that's all right. And then you go right down the middle. And then get rid of that. All right, I don't need that. And now I pick up my catheter. Actually, don't need that either, so let's get that out of the way. My catheter, and get ready. Okay, Mrs. Smith, I want you to take a deep breath for me. And it distracts them as well. And now as you're inserting, sometimes, especially with mannequins, you might have to turn a little. Do not touch the labia. Walk your fingers back. Even though you cleaned it, it's not sterile. So you don't want to contaminate. So you go until you see urine. And I haven't seen urine quite yet. And we'll let you know when we see urine. Come on, Mrs. Smith.
Relax.
Yeah, we tell her to relax. Okay. When we see urine, you go, what does the book tell you? How much further?
2 more inches.
Mm-hmm. So I'm going to go a little bit further with her. And then I take my contaminated, but not sterile, but clean hand basically, and I hold my catheter. This part of the catheter is not going into Mrs. Smith, so you can stabilize it. In fact, you need to stabilize it. If you don't stabilize it, it's going to come flying back out. You'll only do that once, okay? And so since my syringe didn't stay, I'm going to adapt a little bit by being fancy here. And then you inflate the ball, like so. Okay, it will fall back a little bit on a real person and even on the mannequins. It'll fall back a little bit, that's totally fine, okay? Now I'm kind of ookie and gookie, so I'm going to take these off and put clean gloves on and secure the catheter. At this point, Mrs. Smith, she had a full bladder. And at this point, oh, hand hygiene. Let's back up. Hand hygiene, because it's right there. Thank you, Q team. And at this point, Mrs. Smith had a full bladder. And she's saying, this feels so much better. So you're, oh great, making small talk with Miss Smith while you're securing her catheter. Now, oh, this is interesting. Oh, there it is. So on all of the mannequins, you'll see that we already have the securing device. And so,
Oh, great. She broke it.
I broke it. I cut off my first paycheck. Well, it did work out very well. This is not going well. Okay, so there is sort of the way.
We'll charge you for it later. There you go.
Check's in the mail.
The
Okay,
Y right there,
sir?
the Y you want right there at the connection.
Yes. And you'll see once you guys get to practicing that it goes with, it's very simple to secure, and we'll show you during practice if you really need to, but it's got a Y bifurcation, and that's where you lie the tubing. And then the rest of the tubing, like I said, goes on a frame of the bed, excuse me, a non-movable part of the frame of the bed. And then you want to take your clip, your little clothespin, and secure it to the sheet on the bed. Questions about female catheterization?
Why don't you inflate anymore?
The evidence doesn't support the pre-inflation. We used to do it to check for holes. And I think in my whole entire career, I had one with a little pin leak. I don't know if you've ever even had one.
The other thing the evidence says is that the pre-inflation causes little ripples in the catheter tip, and then it's causing urethral trauma as it's going in and irritating that area. And manufacturers will essentially QC and test their devices that we no longer need the pre-inflation. So you'll know if you have a defective catheter because it won't stay. And what's in the tube that she what kind of solution is in here? Normal saline. So it's not going to hurt the body if normal saline goes in that cavity. So
The cap will just fall
yeah.
out eventually,
Yeah.
and so you'll know then as well.
Yeah.
So here's my setup.
Yay.
And we're done with the procedure with Mrs. Smith, and we're gonna cover her up and perform hand hygiene. And not forget. Should I cover removal?
Yeah, I would do
And
removal.
then we'll
Do you
talk
have-
about
do you
boys.
still have your syringe?
Oh, it's right in the box.
We're not digging in the trash. We're just pretending.
Ignore us. Yeah, ignore us. Commercial break. Okay, so Mrs. Smith, you're going home today. I'm gonna come in and remove your I'm gonna remove your catheter. And Mrs. Smith says, "Yay, good. I didn't like it anyway." Hand hygiene. Gosh, doesn't work. Hand hygiene and plain old gloves. Clean gloves is what I'm trying to say. And you'll come into the room with the syringe. Okay, and that's what I did. I came into the room with my syringe and I opened it up and now I have it and I'm ready. So I tell Mrs. Smith, I'm gonna take your catheter out. The first thing you do is take off the adhesive tape that you broke. And unclip the part that's been clipped to the sheet and then take it off and I just kind of put it in between our legs. And then I connect, and even this one you can see uninflates itself. And so I can just kind of hold it there and it'll do that. And all the commercial ones that we use at all of the facilities kind of do it on their own as well. But I want to move the show along, so I'm going to help it. All right, and then this one's, I'm sure now it stays on. Now I just release it. I tell her to take a deep breath because again it distracts them. Take a deep breath, Mrs. Smith. I'm removing your catheter, and she does. And then I've got the catheter itself wound up into this glove. I wind it up into that glove. I take note, 400 cc's of urine, and then I'm going to chart that. And then if this is where you get rid of it in your facility, into the trash, great. If it goes in a different type of container, just know your facility policy cover her up. What kind of urine output can I expect in an adult? 30 an hour, very good. We want to know this isn't in an adult in any area of nursing. 30 an hour is what you would expect for a normal adult kidney function. And so in a 24-hour period, what does your book say about how much you should expect in your Foley catheter?
30 an hour.
Okay, right. But then give me the meat and potatoes of the range. Your book's got it. See who can find it first. Now. Oh, yeah, the range I believe. Well, you guys are gonna come up with it.
1,000 to 24.
Yes,
ml.
1,000 to 24 is what I was looking for. Now let's take a peek at.
How much do these bags hold here?
I think they hold
usually
2, right?
Yeah, 2,000,
That's what I
so
thought.
2 liters per bag. So, usually it's emptied once a shift. So you shouldn't have a full bag for a shift.
Let's see, since I'm not gonna get out a whole nother kit for our guy, I can simulate because the video showed it very well. I'll at least put on gloves because I think that's the right thing to do. I need one more glove if you don't mind. When cleansing the meatus, the video showed it great. I mean, just awesome. From the inner to the outer, take your other Q-tip and keep on going, and then take your other Q-tip and keep on going. But you start at the middle and work your way out. Thank you.
Do you have any leftovers?
Any leftovers?
Leftover swabbies?
Oh, I did. I threw a whole bunch away, didn't I?
We're trash diggers here. There you go.
We're such a professional organization. So, pretending I'm all set up.
This is why we don't post these on YouTube and let everybody know.
Yeah, this one may not make it to the YouTube country where they'll be slicing and splicing. So, inner to outer, and then I'm done, and then pretend I'm in my sterile box. Okay, if the gentleman is not circumcised, you'll have to retract the foreskin. And then after insertion of the Foley catheter, after you see urine, how far do we go? A couple more times. Again, when you're inserting another pearl, pretend this is the catheter. When you're inserting it, you don't touch the head of the penis with every insertion. No. You do the same thing. Walk your fingers back. Insert, walk your fingers back. Insert, walk your fingers back. If, again, if the gentleman has an uncircumcised penis, you're going to retract, is that the word? Replace the foreskin back where it was before. So those are the retraction of the foreskin, the cleansing of the meatus, the drape you can choose to use with the male. I think the fenestrated drape with the diamond makes more sense with the man, a little easier to maneuver, and then it gives you a target area. That makes sense. Trying to think if there's any other differences with the man. Am I hitting it all? Mm-hmm. Okay, any questions about either of these. We're gonna practice them today, and we're gonna be walking around helping you guys out, but it's a task you've gotta practice. We've seen students